Welcome as people are joining us. Thank you for being here today. Welcome, everyone. We have so many people joining us right now. Thank you for joining us on this afternoon. Regardless of what you have going on, you chose to be with us, and we're so thankful that you're here. I'm going to hand the mic over to our wonderful moderator, Andy Feds.
Hey, what's up, y'all? Yeah, I go by Andy Feds. For anybody that don't know me, I always call myself the first ever openly HIV positive born stand-up comedian. I appreciate everybody being here. We should definitely have a great event. I love the fact that we're having this event, especially because we're talking about heterosexual men living with HIV. As somebody a part of that group, I feel like we have not had that discussion as much as we should. So that's what this panelist, or that's what this panel discussion is here to do. By all means, you guys can get comfortable. You guys can, enjoy the conversation. We do have a chat box going on too, so you guys can definitely ask any questions that you would like. We'll talk about those questions in the last 15 minutes of this event. We want to give out a special thanks to the Ring Union Project. They would also like to remind all of our webinar participants, the speakers, and the presenters that we strive to create a safe, welcoming, and inclusive environment for all everybody who attends. So all people living and aging with HIV, their loved ones, allies, and supporters, they all can deserve to be treated with dignity and respect here. So I always like to just mention that we just like to keep a safe environment of judgment-free and non-stigmatized platform. So just a little bit of housekeeping rules too for anybody that needs to know this. So this event is recorded. And it is sent to the registrations to the registrants tomorrow via email. We also have closed captioning. And then, as I mentioned, you guys can use the chat to ask any questions that you would like. If y'all want to holler at the fellas in the DM, go ahead and do that. I heard a lot of them married, so if you know how to fight their wives, challenge them. And then also, if you like to remain anonymous, you can keep your videos off and consider renaming yourself on the Zoom. And then just please take a moment to fill out the evaluation at the end. It'll be administered to you, and it just lets us know what we're doing. So if we can go to the next slide there. Reunion Project, let's talk about them. So they're founded back in 2015. By activists living with HIV. It's a national alliance of long-term survivors of HIV, and they're collaborating with local and national HIV advocates, providers, and researchers. So together, we convene and connect individuals and communities and sharing our experiences of survival and loss while honoring our past and developing successful strategies for living and supporting one another. So today and into the future, we're making sure that people living with HIV have their space. Go on to the next slide there. We also have great sponsors, great funders for this event. We'd like to thank the Gilead. We'd like to thank ViiV Healthcare. And then we also like to thank Broadway Cares, Equity Fights AIDS. So we just, want to welcome you guys and hopefully you guys learn a lot. Hopefully you guys, I always like to say we empower, entertain, and educate people about living with HIV. So let's go ahead and meet our presenters. So these fellas here, we have sharing their story, sharing their experience. So we have Reggie Smith, who's our featured speaker. And then we also have panelists Eddie Lowry. We got Bob Bowers. We got Peter McLeod. And we got Larry Bryant. So I've met these guys yesterday. And listen, y'all gonna have a fun time. That's all I'm saying to you. Let's go ahead and I guess we're going to introduce our featured speaker. Reggie is an executive producer. I'm sorry, executive producer. Sorry. I work in TV. Sorry, I said that a lot. Reggie is an executive director of the Reginald and Dion Smith Foundation, otherwise known as RDSF, a holistic health practitioner, speaker, advocate, and author. The RDSF, their mission is to provide total wellness for families affected by HIV, viral hepatitis, and substance abuse disorder by providing education, advocacy, resources, and linkage to care. And with their virtual network, podcasts, and social medias, they are positively changing the narrative and imagery around HIV and providing safe space and healing solutions by giving agencies to our primary audience of heterosexual Black men and women living with or at risk of HIV, hepatitis, and substance abuse. So, ladies and gentlemen, please give it up for Reggie Smith.
Thank you very much, Andy. Thank you very much. And thanks to all the brothers that are here. And thank God. And though I don't know what you believe in, but I have to thank God and all his grace. I wouldn't be here without it. We've all been through some things, and I want to thank those who have gone on, those advocates, those warriors who have left the planet, but definitely left their mark on the planet. They meant, there's so many of them that mean so much to me. Like those people that are working in the field right now, advocates like the brothers that I'm sitting right here with. And I want to send love to all of you who are out there watching, because there's no coincidences. Everybody's here for a reason. If you're here, you either are interested in the information, God's got you here for a reason. So my message to those that are newly diagnosed, and there's a lot of you brothers out there that are newly diagnosed and are probably scared as hell about what's going on in your life. You think you're going to die. You know, then those that have been living in silence, there's plenty of people who are out there who have been living with the virus, especially heterosexual brothers, because you don't feel like there's a welcoming place for you to get information. And that's not true. And you know, I understand the fear that you fear maybe that you won't be loved. I want you to know that you are loved and that you and our families will benefit greatly when you and we all practice greatest self-love. You know, we're going to stop playing today. My good friend, Christopher Irving, who happens to be gay, like so many of the brothers and sisters that I've learned so much from, reminded me about the cultural trauma that we, especially Black men and women, continue to heal from. You know, I'd like to suggest that we need to be more intentional about how we heal from the trauma of slavery. Now, if you're not gay, or if you are gay, why do you care about what people think about you? I mean, stigma is being more concerned about what other people think about you than what you think about yourself. Stop it. Stop it right now. That's what's really keeping us from being honest. It's keeping us from being, you're loved, and there's plenty of sex out here for you, in spite of your diagnosis. I think that's one of the problems that brothers are, you know, if somebody finds out, or, you know, if I'm meeting a young lady, or if I'm in a relationship and I tell them that I'm positive that she's not gonna want to get down. That's not true. I'm telling you. I don't know what the numbers are. I'm told that there's 8 or 9 single or unattached women out here for every heterosexual brother. The odds are in your favor. Just be honest. That's all they want. They just want us to be honest. And for the brothers that are married or in relationships, we're all human beings. So if you decide to do something outside of your relationship, wear a condom. You know, if you can't be honest, that's the least you can do to help stop spread the virus, right? So we know that there's a lot more medications out here now. Educate yourself and our children. We have to educate our children because they're the future. I'm 67 years old. You know, many of the brothers that are living, we've been living with the virus for 20, 30, 40 years. You'll hear some stories today that will just amaze you. Each one of us has a story that's amazing. We would, you know, love for people to all be courageous enough to share their story. We understand it's not for everybody. Sometimes you're in a situation where your job, you're still worried about stigma. The world is what it is. But, you know, it's been my experience that stress is a killer, and that we're all energetic beings having a human experience, and that keeping secrets and feeling fear alone is stressful, and it presents worse outcomes for us when we do that. HIV is a retrovirus. It's not personal. It has nothing to do with morality, with sexual orientation, what you know or what you think you know. It has everything to do with how we behave. And if you're sexually active, then you're eligible. That's bottom line. It doesn't matter what your sexuality is. If you're sexually active, you're eligible. I'm 67 years old, and I'm a Black man that's been living in America, and I know what it's like to be at risk. And you know what it's like to be at risk as well. Like I always say, it's imperative that we participate in our own survival, because if we're not doing that, then we're most certainly complicit in our own demise. Women are a lot less shallow than we think. I'm telling you, honesty is the key. We don't have time for the bullshit no more. But the good news is that the universe has brought us together to be a positive force in the world. And now is the time. So let's put our petty differences aside. We have a lot more in common than we don't. I was diagnosed in 1988, probably contracted in 1984. So I was an IV drug user, and I've been in recovery for almost 39 years. I'm married. My wife still remains HIV negative. We used condoms until we found out that U equals U. I didn't use medications because I thought that the man was trying to kill me, and that's why he put the virus out here. That may or may not be true, but it didn't matter, because once I caught the virus, the only thing that mattered is what I was going to do with my life. I changed my lifestyle. I stopped eating meat. I stopped smoking cigarettes. I changed my behavior. Through God's grace, my wife stayed with me. She had the courage to stay with me, and I'm telling you, women will. And we found out when we were pregnant, getting tested is important. Even though I shot dope, it took me 3 years to get tested because I was afraid, because I was watching so many friends and family die. I didn't think it could happen to me, but when I found out that it did, that through God's grace, I started doing some different things. I practiced meditation to the best of my ability. These are the healing solutions. And that's why we created the virtual community that we created, so that we can share them together, because my experience has been that we can do together what I couldn't do alone. And it's been a fabulous journey. If you're positive, then God picks you for a reason. And now is the season. And if you can't look around and see that that's the case, then, I'm not a religious fella, but I heard something about Noah built an ark, and everybody didn't make it on the ship. So, Harriet Tubman says she freed hundreds of slaves, and she could have freed thousands more had they only known that they were slaves. Look, we have to dispel the myth that HIV is a gay disease. A big part of that is seeing ourselves in the imagery surrounding HIV and sharing our stories, like my brothers are going to be doing here today. Our organization, the Reginald and Dion Smith Foundation, along with our partners like Phoenix House and so many others, are providing resources like support groups for heterosexuals in our virtual network, the Wellness, Awareness, and Recovery Network. So hopefully that's where we'll all be able to meet folks like you're going to hear from here today, and each other, share our stories, share the information about the things that are available, like our partners Erase HIV, who are working on a cure right now. And we're not at that table. and so what happens when the cure is created and it ain't for us? It's really a lot going on. It's time to stop playing. We've been having a lot of great and supportive messages. I think it's time for us to do something just a little bit different and have some straight talk. Stop playing. Get tested. There's medication out here. You're not alone. You ain't going to die. Some of us have lived in 30, 40 years. You might have to change some things in your lifestyle if you want to be healthy, but if not, it's on you. Everybody's not going to make it. But save the women, save the children, save our families if you don't want to save yourself. All right? All right. So I'm not going to take up much more time. Hopefully we'll be able to share some of these flyers. Hopefully you'll join us in the virtual community so we can continue the conversation. Hopefully you'll stop being afraid of talking about HIV. If you've been suffering in silence for a long time because you lost Uncle Jojo and them or Auntie, and they said it was something else that they died from, and you're dealing with that trauma, please, let's deal with the trauma so that we can stop acting in ways that are not benefiting our community. Hey, it's my pleasure. I thank God I'm alive. It's been a long time. I thank God I'm alive. It's been a long time coming. Some of us have been doing this thing for a long time, right, Larry? You know, we've been doing this for a long time, and
Yes.
so now is the time, and I'm just so happy. Andy, you out there telling jokes about HIV? What's up with that?
We gotta make it, entertaining, because otherwise we're gonna struggle with the depression and stuff. So why not make fun of life and the things we got to go through?
That's right. Well, I'm anxious to hear from my brothers and to let others hear some of the fabulous stories of courage and determination that we have been blessed to be able to experience. And so I want to thank you all for allowing me to share, and hopefully we touched and will continue to touch at least one or two hearts out here today.
Absolutely. Shout out to Reggie with that powerful statement, story, experience. So to piggyback off of him, I always like to tell people, if we are afraid to get tested, we should stop having sex, because we need to make sure we know our status, y'all. We need to make sure that we know our partner status. We need to also protect ourselves and our partners. So big thank you for Reggie for sharing that. Moving on, we want to introduce Eddie Lowry. So for those that don't know Eddie is 62 years of age. He's an African-American man and U.S. military vet who was diagnosed with HIV in 1998. Eddie received his formal training in advocacy through Philadelphia Fight's adult health literacy program known as Program Teach. His advocacy began in 2003, promoting quality healthcare for people living with HIV who are incarcerated. He continues to support returning citizens to linkage to healthcare and reentry services. Eddie is a longtime member of ACT UP Philadelphia, where his advocacy broadened to include all marginalized groups of people along the social justice spectrum. Currently, Eddie is a peer navigator and a certified mental health recovery specialist, and has provided support for veterans and other community members living with HIV/AIDS, mental health disorder, and substance abuse. Eddie is also a 50+ NMAC scholar, and Eddie has co-founded the Philadelphia-based advocacy support group for heterosexual men living with HIV, known as Philadelphia Positive Men's Initiative. He attended the International AIDS Conference in South Africa, where he advocated to end HIV criminalization. He is a member of the Reunion Project, where he supports the development of National Alliance of HIV Long-term Survivors, along with his wife of 17 years, Wahida Shabazz L. So, ladies and gentlemen, give it up for Eddie. Ladies and gentlemen, give it up for Eddie's muted mic.
Yes.
Can you hear me now? Okay, like I said, my name is Edward Rudiger Lowry. I'm from Philly. I'm a U.S. Army veteran for 14 years, and I've been positive for 26 years. Let me explain something to you about the Army. I did 2 tours of Desert Storm, and when we were over there, we was fighting a civilian war, and a lot of us got hooked on heroin. And that's where I think I got infected with the virus. I'm also an ambassador for Reunion Project. I'm also a peer educator for Philly Fight. What I find to be most challenging as a heterosexual man living with HIV is social isolation. I have been trying to connect with other heterosexual men living with HIV who share the empathy of what it feels like on a day-to-day basis, or any given day. I've chose to be open with my HIV status, as well as a way of attracting other HIV heterosexual men living with HIV. So we can address the social isolation together. The one thing that people get wrong is isolation. With sharing our experiences with other people, that's why I want to be more open to other heterosexual men living with HIV. My mentor was a man named John Bell, who taught me and my wife, and also my wife, Wahida Shabazz Lowry, who has been an inspiration since we met in 2004. And my largest challenge in bringing heterosexual men living with HIV together is getting them to come forward and admit that they're HIV positive. That's why I have been transparent with my status. Oh man, you know, it's so beautiful that we have brought this forum into fruition. I'm just so happy that we have heterosexual men that can come together and talk about our status, talk about our life, talk about the things we're dealing with, you know, talk about life in general. You know, it's been so hard to express my feelings and genuinely talk about my HIV status with other people. You know, as you know, it could be a lot of stigma out there. You know, and stigma is for real. You know, we really have to, you know, recognize that stigma is for real. You know, and what is one thing that people get wrong about experiences of heterosexual men living with HIV, who has been your mentor? What people get wrong about heterosexual men is that we isolate. We isolate a lot, you know, and we just have to be more transparent. We have to be more transparent. You know what I mean? Get the message across to these younger people, these young men who are out there suffering from this virus and don't want to come forward. They think it's a game. They think it's a game. I've heard young men say, oh, I can just get the medication. It ain't that easy. It ain't that easy, man. You know, we have to reach these young people. We have to reach them. In order for us to do that, we have to be open with our status. You know, in 2011, Philadelphia Fight came to me to talk about aging men over 50 with HIV. And I ended up going on channel 6, ABC in Philadelphia. Just talking about my status. You know, and I had family members calling me like, yo, I saw you on TV and all this kind of stuff. I said, well, it is what it is, you know? And it's just a beautiful thing, man. It's a beautiful thing that heterosexual men can come together and talk about their status and talk about their lives. You know, I'm just happy to be here, man. I'm happy to be here. That's all I got.
All right. Sorry. Hey, sorry. Shout out to my muted mic too. Everybody give it up for Eddie. Definitely sharing his part in the HIV community. It's super important, especially for young heterosexual men to know their status and to talk about it. Like little fun fact that a lot of people don't know is that like 14 to 24-year-olds are the most impacted by HIV. So it's super important that, you know, even teaching our children, like our teenage children, that, hey, you need to protect yourself. Hey, let's go get tested. Like we need to start normalizing these conversations. So thank you, Eddie, for sharing that. We're going to move on to Bob Bowers, also known as the Pirate, or once a pirate. He is a 41-year thriving survivor of HIV/AIDS living in Houston, Texas. To broaden his message of survival, youth prevention through education, hope, and compassion, he founded HIV Victorious, Inc. in 2005. And as a HIV positive speaker, Bob knows firsthand the importance of putting a face to a disease in hopes of reducing AIDS stigma. He is far from the stereotypical image of a person with AIDS, thus having a profound and lasting impact on our audience. He is generously outspoken about his life struggles and personal choices prior to the time of his infection. Through his public speaking, he shares how HIV disease has helped him to make better choices and appreciate the very beauty of day-to-day life. And for something negative I can say about HIV, what he's saying actually, I can also find something positive to say. It's all about choices and playing with the hands that you're dealt. Some of Bob's awards are the FWA winner of Best Speaking Panel Human Sexuality, San Diego State University, AIDS Network Client Service Volunteer Awards, and AIDS Network Executive Directors Award for Outstanding Community. My fifth grade teacher would be proud of me for reading like this. HIV/AIDS Service, Madison, Wisconsin. Bob has had the honor of being the general with Paz Army in the fight to cure HIV. So, ladies and gentlemen, please give it up for Bob Bowers.
Hey, y'all, I'm unmuted. It's great to be here. Beyond great. First of all, I just want to say thank you to the Reunion Project and thank you to my fellow panelists and everybody on the call.
First, I wrote something, right? Let me show my mic.
Is everything all right? I'm hearing voices. So anyway, I'm a 41-year survivor of HIV. And as I love to say, I didn't get here alone. And that's why I want to not only thank all of you on the call and all of those just participating in the background, but thank the AIDS service organizations, thanks to my family, thank my partners, and everybody who's blessed my life to get to this point. I think it's important to honor our past before we really can appreciate where we're at. And without boring you, I'll give you just a brief overview of what I've gone through and what I've witnessed. I was infected in 1983 through sharing a tainted needle. And during the time when there was gay cancer and GRID, and HIV was not even a thing. And so after watching friends after friend die, after having signs and symptoms myself, I got concerned and finally went to the hospital and was told that I had lymphoma or this thing called AIDS. And being a hetero man at that time, it was a nightmare. So my support came from the gay community, and I just can't express enough how very grateful I am. And so to be here sitting to talking about heterosexual issues is kind of a bizarre thing. But so terms like when I when I first found out, they said that, the obvious that I had ARC. They then said that I had AIDS, and ARC is age-related complex. And I just want you to know that no matter what, no matter how scary, to never give up hope, to reach out to others. I was so fortunate to have that help, or I wouldn't be here today. I was inspired by many people who put themselves out front. I want to mention a couple of names: Rebecca Armstrong and Sean Decker, who inspired me to start working with youth. I first started speaking on the request of AIDS Project Los Angeles, and they asked if I would just go to a local high school and speak. And so when I did, the students appreciated it beyond measure. And so watching Rebecca and finding people like Sean doing their work with youth in the schools, I went on and founded my nonprofit, HIV Victorious. I was speaking before that with other organizations, but our stories are not only important, but as heterosexual men, they're very important. We help break down the stigma for the entire disease to help show that it's not just one face. And so my tattoos, just my lifestyle, everything helped bring in people from the fray that would have never been involved in HIV/AIDS. So out of all the things I've done as an activist, as an advocate, the greatest work I did was in the schools with the youth. I encourage any of you who are interested. There are plenty of ways that you too can get involved, not just in the schools, but beyond. I didn't think there was really a need in this age of you equals you, meaning that you cannot, if you're undetectable, you can't transmit the virus, that there was really a need for a whole lot of awareness in general that we now can take one pill a day. Mind you, I've gone from 65 pills a day and multiple injections to now taking one pill for HIV and 5 other medicines for different issues. And so I just want to say, please share your story, hope, and just remember, it's not who you are, it's what you do that puts you at risk. So beyond any demographic, anything else, just remember it's what you do. It's very easy to avoid being infected with HIV. And I just want to say thank you. And I'm going to stop and listen to others. And please know that I'm always here to help.
Thank you for that, Bob. So I guess to piggyback off of them too, a lot of people didn't know this too. All it takes is one time, not multiple partners, not, sleeping around and being promiscuous. It just takes one time for somebody to not share their status, one time for you to become unprotected. So it's super important to know that and to protect yourselves at all costs. And to just have a casual conversation, talk about STDs, STIs with your partner. It's okay to have those conversations.
Yeah.
So we're going to move on. We're going to toss it over to Peter McLeod. And Peter was already an advocate and peer educator for HIV and became a hepatitis C advocate after being one of the first patients to enroll into a hepatitis C clinic in Cook County. Shout out to Chicago, that's where I'm from. Through his role as an advocacy coordinator at the Chicago's Ruth M. Rothstein Poor Center, he helps empower his patients so they can actively participate in the healthcare. He hopes the summit will help lift the voices of the marginalized populations affected by hepatitis C. So, ladies and gentlemen, give it up for Peter McLeod.
Thank you. And just really happy to be here. It's not often that a group of HIV positive heterosexual men really have an opportunity like this. Not only just to get together and talk, but to share our experiences with the greater population. I was diagnosed with HIV in 1997. I'm a recovering addict. Like many heterosexual men with HIV have that lived experience. And, I'm just grateful to be able to live now a long and healthy life with HIV, to have a positive impact on the people who I run into and talk to and share my experience with. But just really grateful to have lived this long and to now be married for 20 years to an HIV negative wife, woman, Kathy Jacobs McLeod, who was also a nurse who's been involved in HIV/AIDS care for over 30 years. So yeah, I've been fortunate. I've lived a blessed life, and I'm really happy to have this opportunity to share not only my story, but to share this stage with other brothers who've had this shared experience. So looking forward to sharing more and to hearing from my brothers. Thank you.
Absolutely. Larry mentioned, I'm sorry, not Larry, Peter and Eddie mentioned their partners, and shout out to anybody that is in a relationship with somebody that's living with HIV and don't care. That's the biggest thing that we should definitely take into account of being diagnosed is that like we still deserve love, we still deserve happiness, we still deserve the respect. I always teach people too that if somebody don't want you for your HIV, listen, show them the door because they don't deserve you, right? So because you're more than a virus. I always tell people too, I have HIV, HIV don't have me. So we got to definitely keep that into account, and definitely keep that that mindset, that you deserve, you are the shit. You are the shit. I tell people my pronouns is the, she, and it because I'm the shit. So definitely make sure we always keep that value of ourselves. So up next, we got Larry Bryant. Larry is the senior program manager of the Reunion Project, where he contributes administrative and programmatic oversight. That's a big word for me. And technical expertise for the organization. By collaborating with regional and national partners, Larry assists with creating and developing interactive and inclusive activities and events centered around the experiences of long-term survivors of HIV. Larry has almost 30 years working with the HIV/AIDS community, including national organizer with the Campaign to End AIDS, the national movement of people living with HIV, advocating and demanding for the tools and resources to end the AIDS epidemic once and for all. Larry himself, a long-term survivor of HIV, was diagnosed in 1986 and is a native Washingtonian, currently residing in Brooklyn, New York. So ladies and gentlemen, give it up for Larry.
Thank you for that intro, Andy. I feel like this should be like lights flashing and everything. Thank you so much. So honored and privileged to be a part of this amazing panel, to be a part of this group, hell, to be a part of this organization. When I was diagnosed at 18 years old, I was told by the doctor at the Red Cross in downtown Norfolk that I had, based on what he had seen going around, or at least what he knew of the epidemic at the time in 1986, that I had about 6 to 7 years to live. And as an 18-year-old, I was my first year in college. I was an All-American football player. I had no idea, other than death, what was coming for me. And I tried as hard as I could to well, I kept it to myself. I didn't tell anyone my status for 5 years. In fact, the first time I told anyone was my mother 5 years later in 1991, a few weeks after Magic Johnson had a press conference to announce his HIV status. That was the first person that I could look at and identify in some way a connection with what is going on. Death was still coming, but I had no real benchmark. I had no path. I had my life planned out at that point. And I was just unsure as to where to go or what to do. So I just stayed to myself, and I stayed with my family, and I dog paddled until I learned how to walk. But I have to admit, like, for most of it, I just wasn't sure how to navigate my own emotions, my own fears. I was already living with depression and anxiety, so having a HIV diagnosis dropped into my 18-year-old lap felt like I was holding a ticking time bomb that I had to keep secret from everyone on the planet. I remember a couple of years before I started working with the Campaign to End AIDS, of hearing a pair of brothers in South Florida. One was diagnosed HIV positive through a transfusion. The other wasn't. The community was unsure as to which brother was diagnosed, so they just burnt their house down and made them leave the community. And I met a lot of people, and I got messages, as I'm sure Reggie, Bob, all of our panelists can attest to. We get reached out to, and then over the years, people have reached out to me, talking about seeing death, or rather, more appropriately, they would rather hide under their beds and die as an HIV positive man, an HIV positive person, than live through the stigma that was waiting for them in church, at work, at school, in their living rooms, in their bedrooms, wherever they were. That it scared the hell out of me, but I waited to die. And as a Black man growing up in DC and soon Norfolk, Black men weren't welcome much anyway. No one in DC was coming across the river into Southeast to save the epidemic level murders of young Black men, young Black people in the community in Southeast DC. Not even the DC government, um, not anyone. And so the idea that of being tough, of standing up to our oppressors, of fighting epidemics, that was just pretty much ingrained in our blood, in our DNA. I think Reggie mentioned earlier about, slavery as part of it is, whether we like it or not, it's part of our history, it's part of our DNA. And at some point that survival instinct kicks in, and it kicked in for me in a way that I didn't expect. But I began to listen and learn about what was going on around me in the world of HIV, kind of ignoring my own status because, I'm going to die anyway. I just want to get as deep as I can in what I know and what I can learn to help me, to help the people I love, that I was a part of my community. And I remember it was a few just kind of flashpoints along the timeline before I realized, well, I'm not going to die, at least not yet. So maybe I might want to learn and do something. And I remember I think it was October 5th, 2004, for example, when Gwen Ifill was moderating the vice presidential debate between John Edwards and Dick Cheney. She, a Black woman, brought up to the candidates who are vying to run the country, what were they going to do about the rising infection, the rising cases of HIV among Black women if they were to get into office or get back into the office in the case of Dick Cheney. And that was the only time during the debate that they actually looked at each other, because neither one of them had any idea what language Gwen Ifill was speaking or anything, any knowledge or information or awareness about the problem that she posed to both of them. And I'm like, that's kind of effed up. I know I said we could all cuss, but I saw that one coming a long way. But not only that, I started to feel like we're not talking about the whole story. And then soon after that, a writer in Georgia writes a book about something called the down low. And then the floodgates open and fear exists. And now we're blaming men, all men, gay men, straight men, all men. And it had further muddied the waters of individuals who are just trying to find safe port at harbor. I mean, yes, honesty and our ability to be open and trust ourselves and trust the people around us is all key in this process. But when you're living in fear and when you're living in a community or in a society where people are ready to burn your house down, or just kill you or fire you or whatever it takes to get rid of you, then I can understand why some people are not quick to disclose their status. I can understand why some people I know feel unsafe to disclose or have even a conversation about their sexuality in regards to health issues, especially, but not necessarily tied to that altogether. My role models growing up, Arthur Ashe, he refused to fit whatever box people were trying to put him in, and he wanted to fight for the life that he had and loved and wanted to exist in. Mario Brown, a Black gay man associated with ACT UP, wrote an article in 2004, no, I'm sorry, 2000, I think it was 2004, 2005, about getting your Black up among Black men in the African American community, not just people living with HIV, but getting a Black ACT UP movement that protects and leads Black families and Black communities, regardless of your sexuality or your, whatever your affiliation is, your identification is. We need to save each other because you are my neighbor. Especially in response to another article by Andrew Sullivan, who basically wrote, as a white gay man with means living in New York, hey, the epidemic is over for me. Y'all need to move on and leave me out of this, essentially was his article. So fast forward to now, to today, and there's been too much that I can share in this webinar, or hell, a week-long set of webinars about my experience, about my journey, about the fears, about my suicide attempts, about my own depression and anxiety, circling the wagons around my HIV, ganging up on everything that I love. We're still here in the fight, and I'm so excited about this conversation because there's so much that men, I'll say Black men, but heterosexual men living with HIV can contribute to this fight, not just for our healthy and resource outcomes, but for the community that we live in, for the people we love. How powerful is a voice of Black men living with HIV? How powerful is that voice in helping to protect women living, or from experiencing exposed, from being exposed to HIV, from being another statistic, from missing treatments? How powerful can a Black or a heterosexual man living with HIV be as an ally to anyone else in this community when we're talking about this a criminalization, when we're talking about violence in our communities, whether it's against women, whether against the trans community, or anyone else? There are so many tools and resources and just insights and experience that we have as people first, as men in our communities, and as a member of the communities and the family that exists in this Zoom space and throughout the community, throughout this country, throughout the world, that we can contribute to. Those two slides, Heather, if you could put up one slide. As we transition into, I guess the next part is the kind of the group panel and our sharing of experiences and certainly questions from the audience. I was just looking for an infographic of something, of a stat, of just something that kind of encapsulated why we're here and what we need to do from this point going forward. So first, I saw the 6 versus 16%. So in 2021, I don't know if you all can read the screen, reporting heterosexual contact accounted for 22%, or a little over 7,000 of the 32,000 estimated new HIV cases. Heterosexual men accounted for 6% of those estimated new cases, while women were 16%. What that tells me is men are afraid to disclose. Men are challenged to get health treatments, health checkups, to get HIV tests, all of these things. We are not showing up. That's on us. Now, there's a lot of barriers and challenges that I just talked of, and so I'm sure some more we'll explore going forward. But that's us. That's showing us. And yes, whether it from drug use, whether it was however it's described, it's heterosexual contact. I see the question in the chat. So how they applied it was heterosexual contact, whatever that means. It's far less than what women are reporting and accounting for. And another number is 447 to 564. That is the fall in cases, despite a significant fall in cases among gay and bisexual men between 2019 and 2022, heterosexual groups are not following the same trajectory. Since 2021, the progress has slowed to the point with cases not just slowing, but rising 26%, from 447 cases to 564. And the links for both of those stats are very recent. One is from, the first one was April of 2024, and the other is March in 2024. So even today, even when we see in numbers, in facts, that cases among heterosexual identifying partners are going up, something's missing. Something more needs to be done. And I think including and prioritizing heterosexual men both living with HIV is a part of these conversations, especially when we're talking about collective to a community that is all impacted. We have to do more to make that happen. And we, as those men, have the resources and tools to be able to do so. And the more we can do to support those platforms, those opportunities, I hope that we can be as useful and as present to our brothers and sisters in this movement, in this field, in this community, as they have been to us. And I'll stop it there.
Cool. Thank you, Larry, and thank you for all the men that were panelists for today. We are getting close to the end of this webinar discussion. I also mentioned that, I mean, since we got a little extra time, well, I forgot to mention about my testimony. I just kind of gave a little brief, I guess, description about me. But as I mentioned, I was born HIV positive. I got it from my mom, and I was one of those first generations of kids that were living with HIV. Now, me, as a kid, I didn't think about those things. I didn't think about HIV or anything. Of course, I took my medicine or whatever, but I didn't really know of the stigma. It wasn't until as I got older, as a teenager, it was just like, oh, I'm living with this that everybody's talking about. And a lot of it was the stigmas. A lot of it was, people living with HIV, they're about to get AIDS and die, or they must be gay if they have it, and all those type of things, right? And in my mind, I'm like, whoa, I've been living with this in my entire life. When is all that happening, right? I'm 31 years old, and still people in 2024 say, oh, you about to die soon. 31 years old, this must be a slow death. That's gonna be a thing, right? And so it's definitely, we have to understand that, like, there are stories out here of heterosexual men living with HIV. Now, unfortunately, we don't have as many as we should. And I think that a lot of it plays a role with the stigmas. A lot of men are afraid of these stigmas. A lot of them don't want to be a part of that unfactual information, oh, well, people think that I'm, can't be in a relationship, or I can't have kids, or they think I'm gay and things like that. So it's super, super, super important that we also share our stories, just because a lot of men are not. A lot of heterosexual men are not. And a lot of them don't. I mean, I was one of those kids as well. My grandmother, when I was maybe 15 years old, she suggested that I go to my clinic, my infectious disease clinic, and they had a program where it was, kids living with HIV, born HIV positive, that they got to mingle and get to know each other. In my mind, I'm like, I don't need to do all that. What? Because in my mind, I thought that I was the only person, right? And it's because of that stigma. A lot of us do believe that. A lot of us do think that we're the only ones living with this. And one of the men in the panelists mentioned before, we have a community. We have a lot of digital community. For those that, I mean, it's a little cheap plug, but I just created it's called the Blood Relatives. It's a Facebook group now that we people that are living with HIV. If you want to be a part of the Blood Relatives, it's Blood Relatives parentheses Red Ribbon Community. We can enjoy each other's company. We can, empower each other. We can lift one another. We can share our stories and things like that, because it's super important that we do these things. And so I'll close with that, but I also want to open up the floor for any Q&As. I saw that we had a bunch of questions in the comments. And then for any gentleman that would like to help me, that was in the panel, by all means, if you guys want to ask those questions again, because there was a lot that I missed, but definitely ask the questions below, and I'll try to read through some of these.
I just wanted to thank everybody for sharing, and thank Larry specifically for putting things into context. A lot of times we lose that, and with the data, the data is jacked because
Mhm.
there's categories that don't make sense. Others, there's people that don't report. There's the numbers can't tell the whole story. The bottom line is the one, and each one of us and how we behave. And then, we can see what's going on with Black women. And so if they're contracting and they purport to be doing so heterosexually, then what's up with that? I like what Larry talked about too. It was a big distraction with the whole down low piece. That was a waste of time. You know, everybody's having sex, and that's just a whole nother conversation, really. But bottom line is, if you're having sex, like you said, you're eligible to contract the virus. So let's just have more honest conversation around that.
Absolutely, absolutely.
The bottom line is unprotected sex is unprotected sex is unprotected sex, no matter what kind of sex you're having or who it's with. Protection should be the key. Education as well.
Yeah. I want to highlight one question that just came in. Richard Atkins asked, so many great resources that were being shared today. Can we compile all of them together?
Oh, one of the, what we're trying to do in our virtual community, of which I put the link in the chat, and you'll see flyers around, is to have a place where we can share the events, the resources like the groups, the education, and the stories. And more importantly, the healing solutions, the things that we can do to mitigate whatever's going on with us. Shit. Most of us are aging. And so, I plan on living to be 200. So, I'm trying to take care of myself. I don't know what you're going to do.
I don't know what kind of moisturizer you're going to use, but
coconut oil.
all right.
I would just like to add one thing about the whole unprotected sex in terms of risk for HIV infection, and offer that one of the best protections that you can do, or the ways to lower your risk for HIV infection, if you're HIV positive, is treatment. Simply taking your medications as they've been prescribed is one of the best things that we can do as HIV positive people to protect our partners and to, do our part in ending this epidemic.
Absolutely.
Right.
I see a few hands up. I do want to make sure that we do honor the Q&A. So Sanford E. Gaylord, can you unmute yourself?
Good afternoon.
Sanford.
First and foremost, thank you, the Reunion Project and Larry, for spearheading. Please know that I'm late. Don't mark me absent. This is the first forum that I've ever been in where men that are gay identified and those that are heterosexually identified are in a common space, even though it's virtual. So don't mark me absent, but this is so profound that it needs to continue.
Okay.
Larry, thank you for that wonderful nutshell. It resonated. I wrote to you, and I want to say out loud, I thought that I was a triple minority. I'm Black, I'm gay, I've got HIV. My brothers are quadruple minorities. How can we combine our talents and resources, save each other and the generations that follow us? I've wanted that, but it seems as though homophobia prohibits that. Help me understand how we can move past that and save ourselves and the generations that follow us.
Yeah, thank you so much. So when I was diagnosed in 1988, there was only gay groups to find information and to join. And I didn't have a problem with that because I'm not homophobic. You know, I think that as a process of evolution, there because of the way the advocacy of the LGBTQIA community saved our lives, they've taken control, and they control the money and the resources around HIV, the imagery, and all of that, and it's rightfully so. So I think we have to work to share that space and to show the connectiveness. You know, a lot of straight brothers are homophobic, but there's a level of heterophobia as well. So we need to just stop the bullshit, come together, and do what's necessary. It's as simple as that. Really, you know, it really is to me.
No, I completely agree, Reggie, and I'm glad you led off by saying the reason why it wasn't that much of an issue to you early on because you weren't living with homophobia in your heart. And I think I could probably say the same thing. I have family members who have been gay and lesbian, you know, all my life. So it was I saw another human being, and my life probably was saved more than once by folks who either identified as gay or identified as trans, and I have my life to give for that support, even to this day. But we as men, again, we have to just get out of our own way and understand what the larger picture is. The bridge we need to build is not just carrying us individually across, it's carrying us all. And we have to be able to work and live and support, even if we don't love the people we are getting care for, or getting advice from, getting support from. If we aren't strong enough in our own skin, in our own beings, to connect with people who are willing to save their lives and give their, you know, I've been involved with a lot of direct action campaigns. I've gone to jail, and others have gone to jail on my behalf so that we could all be here today. So I think that's a whole other conversation around why the homophobia is there, why this, you know, I think I was in a training the other day where someone was talking about stigma and fear, and how young gay men, lifetime survivors, are going to get care, and in order to kind of blend in, they had to stick the chest out and, you know, act all, you know, macho and tough and everything, which I clearly can't do. And I kind of remarked, yeah, some of us straight guys do that too, just to kind of draw the line before someone draws the line for us. So yeah, we have to get our own way. We have to identify our allies, and also with that same energy, I collectively identify the resources that help to rebuild our communities and save our lives. We got other shit to do. There's a big election coming, so there's other shit we need to do.
Just one thing. I'd like to thank Gilead and Beeve for having some foresight and starting to invest in this conversation.
Absolutely. Eddie, and then I'm gonna pass it off to Felix.
Hey, so I just want to say that, you know, being homophobic was never part of my process. I owe my life to a lot of gay people, gay men and gay women, that taught me that HIV is not a death sentence, you know? And it's very important that we deal with that homophobic situation, you know, really, because they're part of this process as well. You know, part of this process as well.
Absolutely. All right, Felix, you had a question?
More of a statement than a question. Good evening, everyone. It's beautiful to have everyone on the call. Number one, I think that we're cutting ourselves short. There's heterophobia and homophobia. The issue really originated from the labeling of HIV at its beginning. When I was diagnosed with GRID, it was called gay-related immune disorder. And so it was pointed to the gay community. Therefore, the gay community rose up and defended itself and tried to get the help and support that they needed. Being a part of the heterosexual community, I still had to bind with people that could possibly help me save my life. And many of them have perished, but the fact of the matter is that this is still diagnosed as a homosexual rather than a heterosexual or human virus. It should be human, not related to who you have sex with, but the fact of the matter that any sexual engagement can put a person at risk. So we have the pharmaceutical companies, we have the local politicians as well as the federal politicians that we have to re-educate so that we can change some of the barriers in the laws that already exist and some of the heterophobia and homophobia that was created, as well as the prejudice that has been created within those communities. I just came back from a NASDAQ meeting in Denver. I'm retired. I'll be 77 this month, and I came back from a NASDAQ meeting where we are dealing with the fact of the matter that people are aging and getting older as the medications are becoming effective. And the side effects of those medications, which cause us to use other medications and other services. So we have number one, we have to educate, and we have to re-educate a community that was educated incorrectly in the first place.
Absolutely, absolutely. Just for the sake of time, I'm sorry. Go ahead, Reggie.
77 is, you have me at 77.
And I have a beautiful wife, and we've been married 32 years, and honesty is the key. But to get there, you have to practice it.
Hey, can I piggyback off of that for a second, please? One thing I'm glad others brought it up, and that's why I didn't. A good litmus test and just measure of where we stand as far as the stigma surrounding it. I was going to go off about the gay cancer I just mentioned. You know, that's what was going on when I was diagnosed. But that gay cancer term, we were fighting against it from day one. All of us, and not just hetero men, but anybody living with the virus. It was just gay cancer, and it was the most asinine medical decision ever made, in my humble opinion. I said we didn't call things lesbian swine flu or whatever. You know, suddenly we have a gay cancer, and so. As a hetero man, like I said, I really thought the need wasn't really there. It was more for the gay community, more for our sisters of color and things like that, where the awareness and the attention is needed. But try being like myself at 61 years old and to find a new relationship and not only tell your potential wife and partner that you're HIV positive, but then go on to tell her parents that you're HIV positive and that their daughter's not going to die of this thing called AIDS and or, you know, have a life of misery because she's with somebody with HIV. So it's not easy. I don't think anybody, I asked one of our other panelists yesterday if they disclosed to their in-laws and they didn't have to, and I hadn't in the past, but it's still awkward. It doesn't get any easier, but thankfully, you know, the people I was disclosing to were educated and compassionate, but that's not the case for everybody. So I think really, you know, any disease, and look, we survived 2 pandemics, and so we got COVID and HIV, and people were scared out of their minds. I won't swear either. During COVID, I was afraid of coming through the vents, kind of thing. And so I just think it's important to tie the fact that heterosexual men have just as much chance for a long and happy life. They can marry, they can have children, they can be in relationships. Specifically because of U equals U. It takes all that fear out of it. There is no way they can be infected. If somebody wants to argue with that, that's on them and their ignorance. But I think we can really help our cause, if you will, our efforts by combining the fact and coming back home about the fact that it's not transmittable if your viral load is undetectable. Super important.
Absolutely.
Yeah, so
Just for the, I'm sorry, just for the sake of time, I do want to make sure that everybody that has their hand up has their question answered. If we can, just allow maybe one panelist to respond per question, just so we can get through everybody's questions. So Ashley, I know that you were up next, so if you want to unmute yourself.
Just a second here. There we
Yeah.
go.
Hi. So it's for a question, but I just want to ask, like, what's one thing that you would want to hear um going through your earlier experiences from your sisters, as well as me personally. I've been living with the virus for 20 years and I contracted it, and I've partnered with someone who was born with the virus. And even though it's the same virus, way different experiences, um, how do I support my partner's experience? Because it's the same virus but different experience. Um, so that's why I want to ask. Thank you.
Any gentlemen want to take that?
Could you repeat the question?
yeah, repeat the question.
Sure. My first question was, in your earlier years, what would you want from your sisters? What would you need to hear that maybe you wanted to hear, as well as anyone who I identify as a person living with HIV, but I contracted the virus, and I'm partnered with someone living. I'm partnered with someone who um, who was born with HIV. Both our experiences are different, but we still have HIV. So just some, how do I support him in his journey? Because our journeys are different, even though the virus is the same.
I'd like to take that.
Yeah.
So if I could, I guess, give my younger self some advice, I think the only thing, I don't know if it's advice really. I think the only thing I'd want at this point is just someone to listen, non-judgmentally listen. Because I didn't know what to ask when I was 18, 19, 20. I didn't know, the only thing I knew was that I was told by a doctor I was going to die. But to have someone that I felt like I could trust and talk to, even if it was just to cry and yell or scream, that would have been helpful in the moment. I think going forward, though, it was up to myself to, I had to be good with me before I could let someone else be good to me. And I wasn't ready. I didn't trust people. I just had a lot of things going on where it probably wasn't when I finally found myself and was able to figure out who I was, and then of course love myself, then I could allow others or someone else in my life, because I couldn't trust having someone in my life if I didn't love myself. And who would trust being with me if I can't even trust me? So I think it works both of us. One of the things when I'm not working with the Union Project, I also teach peer-to-peer classes with NAMI. And one of the things we always say as a person living I live with depression and anxiety, is that you can't get anyone to treatment. A person who is living with that identified, diagnosed mental illness has to want treatment, has to themselves be a part of their own treatment. And that is the same with HIV treatment. I have to be good with myself and good for myself before I can expect to be good for someone or expect someone to be good to me. So just listen. Be as supportive as you can, Ashley, with your partner. Listen, And I hope that that gives him space to then be able to share anything he needs to share with you. The fact that you are there at all is a blessing for you both, and make the most of that blessing.
I want to pass it off to Donald.
Yes, very quickly. Thank you, first of all, gentlemen, for sharing your experiences. You are an underheard and under-recognized voice, and what you do is very, very important. And I'd like to invite everyone to reframe the issue of contracting HIV a bit from sexual orientation and gender identity, and from youth in terms of prevention, to a new demographic that's been identified, and that is the aging who are contracting HIV at this time due to extended life expectancy, people moving on from partners to partners later on in life, and redefining their relationships and that sort of thing. And so my question is, how can we best partner with you and use your experience and your perspective to address the issue of contracting HIV later in life without regard to sexual orientation?
Any gentlemen want to take that?
You're muted, Reggie.
Thank you. I'm 67, and I know a lot of people, especially as we get older, starting to have, one spouse will die. You start getting into new relationships. There's enhancements. You got that shingling. You got that all kinds of, stuff that'll help men to maintain erections, and people are doing their thing. And nobody's been, from our generation, we didn't use condoms. Or we were with a partner. So it's really about education, trying to get condoms. And if not going to be using condoms, then medications. People that are at our age probably should be thinking about it differently. Not everybody's planning on living to be 200. So, we've got 30, 40 years in the game. If you can get 30, 40 years in now with the medications, no problem. As a matter of fact, I'm taking shots. I'm taking the shot every 2 months. That might be something of consideration. And we should be engaged in the talk about PrEP, which is pre-exposure prophylaxis, which is taking a pill or taking a shot to keep from contracting or passing the virus. It's a different strategies that we need to start looking at as people who are seasoned, because it's good to be able to start having sex again if you've just been chilling for a while. And not be worried about passing the virus.
Absolutely. I might butcher your first name, but I'm gonna call you Miss Anderson. I'm sorry. You probably already knew I was gonna mess that up.
It's quite okay. It's quite okay. It's Carmarian. But
Miss Anderson.
Thank you, Larry. Thank you.
Hey, Kamarian.
Hi, Mama Juanita. Let me see where Daddy at. Hey, Daddy, where he at? He's got no job. Listen, I just wanted to. So I've been around working with Union Project and just been in the field for a while. And I do have one question. I wanted to highlight two things. First of all, let me just scream for these heterosexual men. Hey, y'all. Yes, God. All righty. Nobody else gonna do it. I'm gonna do it. Okay. Yes, God. So listen. So one of the things two things that I heard was. I heard was one, the lack of visibility around this conversation, the tables that I sit at, the grants that I review and so forth, the abstracts I review, we don't get a lot of this type of conversation submitted. So I want to encourage those voices that are impacted in regards to this subject matter, because this needs to be on the main stage. This certainly needed to have been in this year USCAH somewhere, because I think, when we look at data, we focused on our cis-identified women, but we did not focus on our heterosexual cis men a lot of times. So I wanted to just mention that to kind of help dismantle the stigma around the heterosexual, especially male community. The other piece, there was someone that made a statement that was very excited of having same-gender loving men and heterosexual men having these levels of conversation. One of the pieces I know to be true, since I've been in the field and have dated y'all and all the wonderful good stuff that comes with going to heaven, is the piece around how you guys are sexualized, perhaps by the same gender loving community, once you just once your diagnosis has been shared automatically, even with the same gender loving community. And look, I work for HRC, so I see it all the time. Then we will box you in without even asking you what is your sexual preference, but yet will sexualize. I think that's another conversation that could be had. But to my question, so my background is faith, and I always like to talk about faith and HIV. And I'm curious from one of the panelists, how did your faith support, or what was the faith response when you needed it, being heterosexual, being part of this stigma, being categorized in a perception of perhaps you must have done something sinful. How did faith respond, or how did you respond to your faith as a heterosexual HIV reactive male?
Oh my goodness. Well,
You muted,
I
Barry.
don't want to dominate, man, but
Go
I'll
ahead,
tell you.
Reggie. Go ahead.
So I almost died in 2005. Stress like to kill me because I thought I was going to have to leave my wife, because God told me that was time for me to share openly and honestly. And she's not positive, so she had other things going on. It didn't seem fair to her. So I got sick, damn near died. They said if I lived 3 days, it would be a miracle. My church came to my, they prayed for me. My church, and I'm not overly religious, but I haven't caught much flack. Now, I have had opportunities to speak from the pulpit, and then after I finished sharing, the pastor did make comments that made it seem like HIV was a gay disease. So the church is definitely needs a lot of education, but there's no one better to help educate them than heterosexual Black men. Because what they're going to say? They can't say, oh, you gay. So no, that's not the case. And the same thing is true with Black women. You can't say, so, once we get the church past all of the stigma, then maybe that'll help. But, it really depends on the situation. I haven't had any problems, but there is a problem.
I want to add, but I see we have other hands up, so I want to make sure we get to those questions.
Yeah. So we're gonna I was asking Wahida, I don't know if she saw my question, for Cookie, and then I just saw Angie pop in. So if those would be the last two, and then we'll just wrap up just for the sake of respecting everybody's time. So Alicia, if you want to go ahead and unmute yourself.
Hello, everybody. So I have two questions. When it comes to disclosing for heterosexual males, how is it a more difficult conversation than it is for anyone else? I understand that when it comes to HIV in men, it's normally seen and kind of labeled as a gay man's disease, as we've just spoken about. But so how does that change, or how does that affect the way that you disclose?
I'll take that one. So for
well,
me, as for me, I, as you can see in my background, that's my girlfriend there. And so it was a little difficult as far as like sharing my status, just because it does, become the stigma of, well, how did you get it? And especially, me being born with it, I had no choice, right? And as a heterosexual man, not even talking about being born with it, we do face the status of, well, especially in the Black community, oh, you got HIV and you're a man, so you must be DL. I've had that question so many times. So a lot of it is telling your partner, hey, telling them the status. First, that's the first step. Telling them your status, and then educating them that it's no longer considered a gay virus, as it, initially, not we, but as it was brought on to us. And then also just, giving them the factual information about what HIV is, how to protect yourself, how to protect them. And then, also going even more in depth, who's who's impacted by it, and why, so it's just breaking those stigmas as far as the disclosure goes.
Can I chime in real quick?
Sure.
Real quick, how you doing? Disclosing for me to anybody was the hardest thing I ever did. It wasn't easy for me. I ain't tell a soul about my diagnosis for 13 years. Okay, I wasn't telling you nothing. As long as my numbers was good and I'm undetectable, I was fine. Everything else became null and void. My biggest fear was the rejection that I was getting from women if I told them. I did not want to be rejected, so I did not open my mouth up. I don't know about anybody else, but it was a difficult and hard process to me. And the only reason why I can sit here is because of my faith. Okay, because at the end of my road, me doing the drugs and everything else, I just knew I was going to die with the biggest secret of my life, but God, said go to 13th and Spring Garden. And my life began to change. But it was hard for me. I wasn't telling a soul because, I was that guy in the beginning saying, get away from me with that hot shit, because I wanted to hang out with my homies. My homies was talking crap. I'm going to talk crap too. Okay, so it was myself, okay, that kept me from opening up my mouth because I know how I felt. So if I say something, I know how they're going to feel and they're going to reject me. So for that there, it was the worst part of my life it was hard for me. It was very hard because I did not want to be rejected.
Yeah. And then Cookie, you said you had a second question?
Actually, my second question got answered within those answers. So
Gotcha.
Thank you guys. Thank you. I appreciate that.
I love it when that happens.
They call you up for being here too. Yeah.
And then last one will be Angie. You had a question?
Yes, hi, I'm Angie Keys, and I'm from Kansas City, Missouri, and I'm a advocate for women in stigma here, and I'm just so excited to see and to possibly be a part of anything that has to do with heterosexual. In Kansas City, I had just raised a question to a program that came and was asking questions related to funding. And it's just my personal advocacy is around the stigma because I realize that here, the people that engage are very few. And so I see the opportunity and the need for men to come to the table. But I'm celebrating 29 years of living as a positive Black female. And so I just want to make sure that whoever, I guess, is over this particular group, that my information, because I just happenstance on this call right now. So I really want to make sure that I find out who do I send my information to be a part of, because we have no anything, outlet, nothing for people that live a heterosexual lifestyle. It's still in relationship to gay men. And I've been fighting to be a woman out here. And so I'm finally at the table. I sit around a lot of tables, but I'm trying to seek funding. I'm trying to do all I can, but I continue to do the programming related to stigma overall with all health disparities they call stigma. So I want to make sure is this Alberto Perez?
No.
That's it.
Angie, this is Larry. I put my email in the chat, Larry@reunionproject.net. Just email me and we'll talk.
All right, then. I do appreciate it. And I'm so excited to be able to bring this information to my community for those who are still in denial or related to stigma. So I'm excited. Thank you.
We are closing up the webinar discussion. So I want to ask any of the gentlemen in the panel if they have any final statements, and also drop y'all handles too for the people in the chat if you haven't already, just that we can build this community.
I just want to say this is a great start, but it's only a start. I mean, we've had hit and misses in the past over the last 20 or so years I've been involved, but we've never been able to keep the momentum going and to really have a discussion that's going to be impactful, that's going to bring more heterosexual men into the circle. So let's follow up. Let's do the next steps. Let's make sure that this conversation continues.
Absolutely.
Hello. Hello. This is Vernon again. I come out late because I was on dialysis and to join this meeting, but I am very interested in trying to spread our viewpoints and share in our community, because for years it has been a neglected topic, and it's about time. I happen to be in a very good community in Philadelphia where we have began to organize and get together to have more heterosexual support groups, because they were very, very limited. So I'll share information with anyone if they need to be. I had a small nonprofit called Gordon Wright Community Development Corporation, and we've been in existence now for about 25 years. And part of it is being able to assemble and disassemble information. So and networking.
Mr. Wright.
Networking is, yeah.
Yes, so I put my email in the chat. I send it directly to you. Please contact me. You're in Philly, so you're near Eddie and Wahid, and we'll make sure you get connected as well.
Can I say something real quick before we go to the panel?
Well, we're about to end. Andy is trying to wrap us up. I'm sorry.
All right.
Yeah, I just want to say, the brother that's from Philly, I'm gonna leave my email in the chat box. We're trying to start a group called the Positive Men's Initiative. So if you want to be part of that, just email me.
You said it in, okay. Is this, what's your name?
My name's Ed Lowry.
Ed, you and I met at a couple of weeks ago.
Aging and Thriving, yes.
Oh,
yes, that's
okay.
right.
All right.
Yeah.
Yeah,
So I'm still, we exchange information. Give me a call or text, email me, either one.
All right, I'm gonna
so
put
that
my
we can connect
information in the chat box.
All right then.
Yeah, I love the energy around this conversation. Now's our time. Thank you to the Reunion Project for putting this together. Let's continue to have this conversation. I will be with my wife at the United States Conference on AIDS. If you're going to be there, holla at us. And please copy as much information out of the chat and check for more things coming out of the Reunion Project so that we can coalesce and put our petty differences aside. I always like to say, if your ass is on fire, excuse the pun, the only thing you want to know is where is the water. And right now we have the water for each other. So let's share that.
Hi, everyone. I just want to break the fourth wall for a second. My name is Heather O'Connor, and I'm the program coordinator for the Reunion Project. Before I let you go, I have to tell you about some upcoming events that we have going on. We're going to be in Denver on August 23rd and 24th. This is an in-person town hall, and so if you're around the area, please look into it. Register for both day 1 and day 2. We'd love to see you. If you know folks in the area that would be interested, please let them know. The link to register is listed on the slide, and you will receive this slide after this webinar in an email tomorrow. We also have a mini grant opportunity. So we've had a lot of talk about wanting to convene and wanting to bring one another together to celebrate our long-term survival. We are offering 4 mini grants of up to $4,000. And we would absolutely love for you to apply. So if you're interested, there was so much inspiration in this space today. Please take advantage of that. We would love for you to do that. Also, here are some helpful resources that Reggie mentioned earlier. Again, you'll get these slides so you can check them out when you get them tomorrow. And here's how you can connect with us. We want to keep the conversation going. This conversation about heterosexual men living with HIV is a conversation that hasn't been had and often. And so it's so great that we're having this conversation. We want to continue to connect, continue to talk, continue to raise awareness and speak our truth. So please connect with us. We really want to hear from you. And I'm going to pass it back over to Larry because he's about to say something.
This last thing I wanted to say, yes, we need to keep these conversations going. I really love the energy that was brought to the table today by everyone, not just our panelists, our moderator. Thank you, Andy, but to the entirety of the participation in the crowd. Thank you so much for being here. We need to also remember this conversation isn't just in English. We got to lift up our Spanish-speaking communities, our Spanish-speaking brothers and sisters out there as well. And just want to shout out, I know Andy has shared himself with us, but I also want to give a additional shout out, if you will, to the lifetime survivors, some of whom are in the audience now, young men now who were born living with HIV. So I just want to make sure that as we continue this conversation, that we think about all of us going forward.
Absolutely.
Yes.
So they call the young ladies that are born with the virus dandelions. What are brothers that are born with the virus called?
Yeah, how about that? Yeah.
You're gonna be called whatever you want to be
Dandelion can
called.
be a
I
man or a
definitely thought
woman.
that was an everybody thing, like everybody
Yes,
born
a dandelion can be a man or a woman. I know Mary Bauman did the poem, but it's anyone born with HIV.
Self-identification is very powerful. Tell us what you want us to call you, and there you have it.
Richard, that's
You
for
have,
you.
you have the power.
Muted, man.
I just want to say thank
Andy,
you so
Andy,
much
you're
to
muted.
Andy. Thank you, Reggie. Thank you, Eddie, Bob, Peter, and Larry. We are past time, so we have to let you go. We don't want to, but please connect with us. And
It's very
please fill
great,
out
yes.
the evaluation before you leave. I will put the link in the email tomorrow. So if you don't get a chance to do it today, then you can do it tomorrow. So much love. Thank you all so much for being here today.
Thank you. Well, everybody.
Thank you, everybody. Great job. Great job.
Bye.
Look
Thanks
for
for the love.
Look for the recording and share it with your friends.
All right.
Yes.
Bye, y'all.
Bye.
Bye.